Hello, everyone. I got asked a question by a front office how to manage patients, existing patients, not new patients, who threaten to leave the practice and go somewhere else if they don't get the appointments that they need on the day. So they go in the practice, they have a problem, and they want to be seen on the day, and our appointment book is fully booked, and we can't get them in today, and they're threatening they will go somewhere else, and how to deal with them. First, for credibility, my name is Khaled. I have been a dentist for 20 years. I run my own dental practice, Lakeside Dental Spa in Halfway Bay in Queensland. I took from one chair to 10 chairs, from 3 staff members to close to 40 staff members over the course of 15 years. And you can check my details below for credibility. So, first thing we do when the patient is calling the practice, we establish first thing whether they are new patients or existing patients. If they are new patients, then it's not going to be covered in that video, and usually they're not threatening to go somewhere else because they haven't been here before. But with new patients, we don't ask a lot of questions. We try to get them in the practice. We try to give them appointments, and depending on the appointment book, of course. Um, if it's a new patient, it's an emergency, and we don't have any emergency spots, you probably lost that patient, and probably because you don't have the capacity in your practice to get patients on the day, or you've been over capacity, you have to accept that loss if it's a true emergency. But let's talk about existing patients. So this patient is calling the practice, and they have a broken filling, and they want to be seen today to get this filling fixed, and we don't have any appointments available. And the front office telling them, we're going to put you on priority list. Promise you, if any availability, we'll give you a call, we'll get you back in again. No, that's not acceptable. I want to be seen today. And I'm a patient of your practice. How I cannot be seen today? I'm going to go somewhere else. How can you deal with that? I would probably, if I was on the front, I would just pause and I will ask the patient to repeat again. Anything that the patient threatens or insults or anything like that or unusual, I want them to repeat it again, only because sometimes they might change their mind. They might, consider their words or choose their words a little bit more careful. So I would say, I'm sorry, I didn't catch that. Can you please repeat that again? And again, if they repeat again, like, if you don't give me an appointment today, it's not acceptable. I'm gonna go somewhere else. Then I will put the behavior back on them. Did you actually mean for that to sound like threatening, or did you mean for that to sound that you actually want to leave our practice and not come back in just because we can't give you an appointment today for something that's not emergency related? If it says yes, then I don't think you can do much of this patient. You probably lost the patient, and usually you'll find this with patients who are not regular visitors in the practice. So have you actually lost the patient, or they already not regular in the practice? They came once 3 years ago or 4 years ago. But I want to track back a little bit of all of that. You have to have a clear system of classifying true emergencies from non-true emergencies. So if this patient is calling, I got a broken filling, I want to know exactly if it's a true emergency or not. And you should have in your practice some questions to ask about true emergencies. So if it's a broken filling, what if it's a front tooth? It's a front tooth, and the patient who's medically driven, so they work in a job where they smile and they talk to people, they can't really function without a front tooth. It doesn't look good for them. They're real estate agents. They are working in TV presenters, who, whatever the job that they're front tooth, they're very self-conscious of. They can't hide for a few days until it gets fixed. This is a true emergency if it's an existing patient, existing regular patients. Even if we are fully booked, I want this patient. An experienced dentist should be able to manage that in 10 or 15 minutes, just putting composite with some edge and bond, not shape it perfectly, getting out of occlusion just to get the patient with a tooth, then book them in a few days later to remove that and do a proper filling or a proper crown. Pain, but the pain is they couldn't sleep last night, doesn't go away with pain relief, they didn't go to work because of pain. Those three things mean that this is a true emergency. Again, an experienced dentist should be able to squeeze the patient in, get them out of trouble, give them anesthetic until they can book them in the afternoon, extirpate, take the nerve out, put some dressing inside the nerve. An experienced dentist should manage that really efficiently and on time if it's an existing patient. So this patient ideally need to be seen on the day and finding time for them. We'll talk about how you can find time for them. So talk about front tooth emergency, pain, emergency, temporary crowns, again, 5-10 minutes max, can be fixed. Implant emergencies, a loose all-on-4 or a loose crown or something like that moving. You want to see this patient, you don't want them to wait for a long time because they can break the screws. Again, an experienced dentist should be able to manage that really quick. Those are true emergencies, but there could be other lists as well, but it's something you will have to create in your practice. if those true emergencies happen to existing patients, you want to get them on the day. And you want to be very strategic on when you can get them. Get them in a time where the dentist could hopefully be able to get them between appointments. They can catch up on time. There's like a bunch of exams, bunch of scale and cleans, other things that maybe the dentist, a premium plan with 5 fillings, they might end up doing 4 fillings so they don't run late and see this patient. But don't put it in a time where they're doing a dental implant or something where they cannot step out of the room to manage the emergency. So don't ask the dentist as well, just get them on in the book, because there's a chance you might ask the dentist, they might say no because they're like really busy at the moment, and then you tell the patient no, and the patient's not going to be happy. So those are emergencies where I want to get the patient on the day. But if it doesn't fall on that, I will tell the patient, look, I'm really sorry, I know your feeling is broken, but it seems like it's something that doesn't have to be fixed on the day, probably can wait for a few days. I really don't have any appointments today, would love to see you, but if we see you today, that means we're going to compromise other patients, and we're going to compromise you. It's not going to work for you or the other patients. It's going to be unfair to you and to them. So what about if I put you on priority list? Let's book an appointment on like in the next available, let's say in 2 days. Let's book that appointment in, keep it in place. I'll put you on priority list. If something has changed, I promise you, I'll get you in. If you do that, and they do at the beginning of the video where saying that I'm not gonna go, I'm gonna go somewhere else, that's when you can pause, ask them to repeat, and ask them, did you mean for that to sound like threatening that because just we can't get you for something that's not true emergency, you're gonna go somewhere else. If they insist, then wish them all the best and nothing you can do about it. But that's how I do. So I classify into true emergency or untrue emergency. If it's true emergency, I want to get them without even asking the dentist. I just want to find strategically time in the book to get this patient in. We shouldn't have a lot of them from existing patients because usually we manage them really well. If it's untrue emergencies, use this technique where, like, really sorry I can't get you in today, put you on priority list and so on. If they insist on threatening you, they're going to go somewhere else, pause, ask them to repeat again. They repeat it again. Did you mean for that to sound threatening? Given that it's not a true emergencies, really want to keep you in the practice. Yes, I'm gonna go somewhere else. Wish them all the best. Nothing much you can do. If you find the information helpful, make sure you like it and share it with your friends and colleagues. If you want to hear more about my videos, please subscribe to my channel, and you'll be notified when more videos are released. Thank you so much for listening to me. It means a lot to me.